L4, L5 disc bulge, L4, L5 disc herniation. If that's something you've been diagnosed with, then this video is for you. In this video, I'm going to give you 5 simple stretches that you can do at home to get some relief for your symptoms due to L4, L5 disc herniation or disc bulge. I'm Dr. Manish with Princeton Spine Disc and Chiropractic. Now, what this channel is about is giving you tips and information on how to help you relieve lower back pain, what things you can do at home to help yourself. So in this particular video, we're going to talk about 5 stretches you can do at home to help yourself with chronic lower back pain or L4, L5 herniated disc. All right, so the first stretch I'm going to show you is called single knee to chest. Now every stretch we're going to do, they're going to flow into the same smooth motion. We're going to have you lay down on your back. Now make sure to do these stretches either on a firm table or on the floor or the yoga mat. Doing stretches in the bed usually don't tend to be that great because the bed gives in and you just don't get a good stretch. So let's go into the first stretch. Again, this stretch is called single knee to chest. So I'm gonna go ahead and lay down on this table over here. Want to make sure that both my knees are bent at 45 degrees like that. And always grab the leg under the knee, not over the knee. Because if I grab the knee over here, and I can certainly pull that. However, I'm going to end up stretching and putting more stress on my knee, which I want to avoid. So we're going to grab the knee under the leg like that, and then bring it up towards your chest. Extend out the other leg, and make sure to breathe in and out to your belly comfortably. Don't hold your breath. Again, I see a lot of my patients when they do this, they typically stop breathing or they don't breathe good enough. So we want to always maintain proper breathing motion through the belly. So you want to take deep breaths in and out about 5 times, so about close to 2 seconds. So you can hold this stretch about 5 seconds. If you want to do it a little bit longer, that's perfectly fine, not an issue at all. When you're done, bring this leg down again, bring this leg up again, and repeat on the other side. So again, grab this leg, bring it to your chest, let the leg go, and again, just breathe and relax. You should feel the stretch in this area over here. Now, let's go to number 2. The stretch number 2 will be, the next step or the next stretch, so I like to go in the sequence. And again, first one was single knee to chest. Well, this one's gonna be double knee to chest, right? Again, we're gonna lay down on the back. Same thing, the knees are at 45 degrees to eliminate stress on the lower back. This time, I'm gonna grab both my legs under the knee and bring them towards my belly or towards my chest. And I'm gonna go and breathe through the belly about 5 times. Obviously, I'm not going to do the whole 5 times. It's going to take a little bit longer. But again, you want to hold that stretch for about 5 to 10 seconds. And when you're doing that, you should feel the stretch more towards the lower back in this area over here. And once you're done holding the stretch, gently relax your legs and let them rest. And we're going to move on to number 3 after that. Now let's talk about number 3. So we've done single knee to chest. We've done double knee to chest. Number 3, what I call is knees to the side. So again, let's lay back down on the table. We're gonna start as usual, have the knees bent again to minimize the stress in the lower back. And these are called knees to the side. So what basically means knees to the side. We drop the knees to the side as far down as possible without forcing anything. We want to let the gravity do all the work. Now with this one, we want to make sure that we don't lift up the shoulder on the opposite side. So again, let me do on this side. As the knees goes to the side, we don't want to twist. We want to make sure the upper half, the shoulder blades are resting on the floor or on the table. And you should feel a nice stretch from the side of the hips here all the way down to the leg here. And to make your upper chest, a little more stretch in that area. You can also extend your arms out to the side, and that's going to give you a really nice stretch to your chest, down the arm, and also all the way down through here in this area as well. Number 4 is going to be figure 4 stretch. This is a typical stretch a lot of people have probably done in the past. Again, it can be done in 2 different ways. I personally prefer the one laying on the stomach. Laying on my back, not on the stomach. The other way to do this stretch is by sitting, which I generally don't recommend, especially if you have a disc problem, a bulging disc. I would recommend it. But again, if you don't have a place to do this laying down, you can certainly do this sitting in your chair, where you would bring one leg over the knee and you would just lean forward, going forward like that. When you do that, you should feel the stretch in the buttock area of the leg that's sitting on the other leg. Now let's do the same stretch, and show you how to do that laying on the back, okay? So again, laying on the back, we're gonna lay down, same way as usual, knees bent. Now we wanna bring one leg over the other knee like that and let it rest. Now, it may not fully open up, and that's perfectly fine, because a lot of times people will have a lot of tightness to the hip area. So the leg may just be at an angle, and that's perfectly fine, not an issue. No need to force anything in here. As we do more of the stretches on a consistent basis, it should start to open up. So again, have the leg sitting on the knee like that. We want to make sure that we use both our hands, and we put our hand through this little opening between the leg. Again, this looks like a figure 4, right? That's why we call this a figure 4 stretch. We bring the leg, grab the arm, grab the knee using our hands to this little hole right behind this, under the knee, and grab through here. And we're gonna go ahead and bring this leg to the chest like that. And again, breathe through the belly. You should feel the stretch right through this area over here. And that's typically a piriformis or gluteal area right there. So far, we have gone over 4 stretches: single knee to chest, double knee to chest, knees to the side, and figure 4 stretch, right? All of the stretches were done laying on your back. Now the last stretch that I really like to do, which I find that it's pretty effective, standing up. Again, that also minimizes pressure on the back. So in this one, we call this a fencer, like a fencer stretch. We're going to stretch out the hip area over here, especially the hip flexors and the psoas muscle, which are the biggest muscle involved in the lower back problem, or the bulging disc issue as well. So what you want to do is you want to get in the fencing position like that, like you're fencing, right? And then so you're going to have one leg out and other leg right in the back. You want to make sure your toes are pointing straight ahead, not to the side or not to the side like that. You want to have them pointing straight ahead, and you want to take a larger stride forward. That way you are not arching on the back. So the further the step, the better the stretch you're going to have over here. Now, you want to make sure the back heel is coming off and you're bending at the front knee over here. So the heel on the back foot comes off, knees bending, and you should start to feel stretch over here, keeping your back straight. Now, to make the stretch even more effective, you can put the arm up on the side where the leg is on the back side. The same arm goes up. Now imagine somebody's pulling their arm up, like tractioning their arm up, and you're going to start to get more stretch through this area over here as well. And you slightly lean away on the opposite side, and you're going to get a lot more stretch all the way from your hips to your lats over here. And you hold that position for about 5 to 10 seconds, again breathing through your belly, and that should give you a good stretch, and then repeat on the other side. So we've just shown you 5 stretches that you can do at home. Hopefully this will help you manage your symptoms at home. Now, if for whatever reason, if it's not helping, you may need additional evaluation or some other stuff. So if you have any questions, any comments, leave in the section down below. Subscribe to the channel down below as well, because that way we can help you give more tips on how to manage your lower back pain, bulging disc issues at home, and looking forward to giving you guys more content going forward.